Well, it's time once again to meet with the folks from the Apple organization, Addison Partners for Play, Learning, and Education. But we have some new team members here on the Apple team, and we're happy to introduce both of them to you today on our program. Joining us is Maureen Reedy, who is the new project director for Apple. So Maureen, welcome into your position. We'll learn about you in just a minute.
Thank you.
And joining Maureen, we have Jillian Santora, the local interagency coordinator with Child and Family Connections of DuPage. So Jillian, welcome to you as well. And we'll chat a little bit about your organization, the work that you do here in the DuPage County area in just a moment. But Maureen, first of all, you're filling Mary Haley's shoes here, big shoes to fill, obviously. Tell us, how did you find Apple? Apple find you? How did this all work out? And now that you're here with us in Addison.
Yes, so I've worked in the early childhood field my entire career. My most recent position was with Metropolitan Family Services in DuPage. I worked as a home visitor in that program, and subsequently after that position have now transitioned into a new position with Metropolitan Family Services as the project director for Apple. The previous position as a home visitor was really more of a direct service role, working directly with families. And this new role will allow me to work on kind of more of a community level in the early childhood field. So I'm very excited.
Now just help us understand, Metropolitan Family Services is the umbrella organization for Apple, is that
exactly,
correct?
Yes,
Mm-hmm.
yes.
All right. So you were able to move into, as you say, kind of more of a community-based approach to the service delivery that you provide and working with collaborators, organizations such as Jillian's here. Yes. Have you noticed in your years working with Metropolitan, but also some of your other experience, that the idea of early childhood intervention, education, service delivery has really grown? I mean, we've learned a lot about these different organizations in the last several years. I imagine throughout your career, you've seen this expand, and obviously your education kind of led you to this field that you're working in now.
Absolutely, yes. The early childhood field has really expanded and really become a major focus, especially in the last decade or two, and we're really glad to see that happening. It is such an integral part of the, of a child's life, mm-hmm. and it's so important to focus on that development at that stage in order to provide for their better future once they get to school age and beyond. So it's very important that we're focusing on that age right now.
Is the community approach to early childhood learning, early childhood intervention, is that kind of the model that is maybe best served now as opposed to maybe years past when, young children, families, young children, they just said, well, we just start them in preschool or kindergarten, and we just kind of hope for the best. So mm-hmm. Is the community model, community approach better in today's educational climate than maybe years past, Maureen, from your experience?
Absolutely. We're really trying to approach the whole child and the whole family and serve the whole child and the whole family. And make sure that they get the resources that they need in every aspect of life and development, and really trying to reach them, as we were saying earlier, rather than waiting until they get into kindergarten or even into a preschool program. Really trying to reach those families and those children to provide them with what they need to succeed.
And I suppose the more diverse a community is, things like language and outreach, accessibility become challenging. And yes. I know you have staff that, for example, can work with a bilingual portion of the community, because if you can't talk to the parents, what good is the services that you're going to be providing? Right?
Absolutely.
So that's a challenge.
Yes, I'm so fortunate to work with Rosie Galvez, who is very integrated into the community, and she is such an incredible partner to be working with.
And that's hard for families and for parents, isn't it? Right?
Yes.
It's hard to get help.
It really is.
There may be an issue, then I don't know how to deal with it.
Absolutely.
Who do I talk to about it?
Absolutely. So she is essential to be able to break that barrier, break that language barrier at least, and be able to connect with families and make them feel heard and supported and get them the resources that they need in the community.
Right. Well, Jillian, let's talk now about the Child and Family Connections of DuPage. So tell us how this organization is structured, and where are you based at, and kind of the purpose behind the agency here in DuPage County.
Absolutely. So there's 25 Child and Family Connection offices through the state of Illinois, and we're the point of entry for families for the early intervention program. And so early intervention provides services to young children ages 0 to 3 who either the family has identified there's a developmental concern, or maybe the child was born with a developmental disability that's going to lead to a developmental delay. And so we are the point of contact for families who are interested in accessing services. They can reach our office through phone, email, IRIS, which I'm sure Maureen will talk about, but in order to just kind of access that early intervention program.
Is this a state funded agency then? You mentioned that there are many throughout the state of Illinois.
So it's actually a federally mandated program. So we receive both federal and state grants for services, and it's available to any family in the state of Illinois.
Good. So what do you do? Now, let's say a family comes there through a referral or they find you, and as you said, a point of entry for those services. Is there an intake process?
There is.
Families? How do you
So we house the service coordinators who act similarly to a case manager for families and helping them almost as a liaison to the program. So when a family gets enrolled with us, we do start that intake process. And in that process, we are gathering consent for evaluation. We're providing the developmental evaluations to determine eligibility for the program and for services. And then for children who are eligible, we link them with service providers and then monitor their service plan.
Does this differ from perhaps a model that was used in the past? Was it more of a clinical service, and how does that differentiate now with the Connections organization?
Yeah, so there's two main differences between our model and the clinical model. So one is that we're a natural environment-based program, so early intervention services are provided in that child's natural environment, whether it's the home, a daycare, a child care center, even if they're at grandma's house during the day. We'll go to the child for the evaluations as well as the therapy. And then also we're looking at eligibility from a developmental lens versus a medical model. So we're looking for a child to have a 30% or greater delay in one of 5 main developmental areas.
I see. All right. So you're watching them, observing them, as you mentioned, kind of in their comfort zone, their natural environment, far and away better off than if they were in a rather intimidating setting, like a clinical setting, a doctor's office. No offense to doctor's offices, they're wonderful, especially as you get older. But for young families, young parents and children, it's hard enough to be able to talk about this. So
it is.
Go to their turf.
Exactly, especially when you're looking at a child under the age of 3. You know, where are they most comfortable? Where do they spend most of their time? You know, you're going to see a different picture being in the home than if you brought them to an unfamiliar situation and asked them to start stacking blocks and things like that.
Right. Because you're probably asking the parents to go more on recall. How do they how does this happen? How do they interact? And they're not going to remember all the little idiosyncrasies. Of
and we do. Our assessments are very play-based, and so we're taking parent report and then also, you know, kind of facilitating some of the things that we need to see through play. And so if their toys are there, you know, we'll get a better idea of the skills that they have.
They probably don't want you to leave.
No, usually they don't.
Right. Now, is there a fee structure for that? How does it work with early intervention?
So there's no fee for any evaluations. Those are provided by the state. And then once a family is eligible, there is a sliding fee scale. It's based on family size and gross income. Right now, that fee is waived for all families. That was under the umbrella of the COVID health crisis. There was no fee for services. It is something that will most likely be reinstated at some point. But again, it's based on family size, gross annual income. So some families don't have a fee for services, and then some families pay a monthly installment.
Does private insurance cover something like that?
Yes, we do bill families insurance to the extent possible. The state's the payer of last resort, and so if the insurance does pay, families may not be responsible for their family fee.
How long would a child be in an early intervention program that you're describing?
It really varies. So it's available for them up until the day before their 3rd birthday as they continue to need it and meet eligibility. Some kids are with us for a short time. They, you know, have a attainable goal. They come in, services go great, and then we celebrate that graduation for the program.
I'm sure. Yeah, it is a celebration.
Absolutely. And then some families are with us until they turn 3 and transition from early intervention into the early childhood program.
Yeah, I was going to ask you, so what happens then when they do transition out, whether it's at the 3rd birthday or even prior to that?
Yeah.
Who finds out who kind of takes the handoff then from early intervention?
So typically we're transitioning them into the early childhood programs through our local school district.
Okay.
So we start that about 6 months before the third birthday, linking them up with a representative from the district who will help the family access those
So
services.
that would be Addison School District 4 that would take
Yep.
the handoff, is that right? Right. Okay.
Absolutely. And so every district is offering some sort of an early childhood program. They'll evaluate the children for that program from an educational lens versus that developmental model that we have. And then if they are eligible, they have a nice seamless transition right from early intervention into the early childhood program. So there's really no gap in their therapy services.
Have you had enough opportunity to study some of the maybe quantified data, statistics of successes when an early intervention program is in place as rigorously as you have described it here, birth to 3, and then they move into the early childhood center locally here in Addison, for example? And how do those statistics differ from maybe 10 years ago and,
Right.
and 20 years ago? Where are the success points that you're seeing along the way?
Absolutely. Maureen had alluded to that, birth to 5 critical period, and birth to 3 is such a critical period for brain development. So the sooner we can get in there, make an impact, and start working with families, the more progress we're going to see. And frequently, we do have families who are referred for school services, and they have that evaluation, and they don't qualify for school. They don't qualify for special education, which is great. And then maybe they do, but then by kindergarten, they're caught up. So there really is that push that the sooner that there is an identified need or concern, that the families reach out and access the services.
And you're able to put probably a profile together of each student because you've spent time with them for however many years or months. And then when they come over to District 4, that's already in place. Those are already known services, deliverables that the school district and or the Apple through their other partner agencies are going to be able to provide them locally. Right?
Yeah, and I think that's such a nice handoff from early intervention to early childhood. If a child's not involved in early intervention, then they're just going to be pursuing like a early childhood preschool screening, and that may or may not occur before their third birthday. It could be next screening we have is 6 months from now, so we'll schedule that screening, and then they've lost that time in services potentially. So early intervention to early childhood is just really seamless.
What do parents? What are their number one questions when they come to meet with your team? And they're coming in, or your team is coming out to meet with the family and their child in their home environment, as you mentioned, kind of in their place. What are some of the questions that they ask, and really concerns, I would think, at that point? It's a very sensitive area.
It is, and it's so varied. Some families are coming to us just because their child maybe doesn't have as many words as they thought they should have. And then we have other families who are coming right after a 3-month stay in the NICU after the child was born, and there's been a whole health history that's going to impact this child's development. But a lot of times families just want to know what's available to them. They've been told about early intervention, but they don't really know what that looks like. So our service coordinators, when they do that intake meeting, they go over all the different services that we can offer families, and then we have 3 different questionnaires that we do just to learn about the family routines, the family priorities, the skills that the child may or may not have at this time, and then that really helps us make sure that we put the correct therapists in the home to help determine eligibility.
That has to be a huge relief for parents. They aren't sure. They're probably getting less information or misinformation about things that is not the most reliable. I would imagine there is a huge sense of relief, regardless of what the plan is going to be for their child in an early intervention, if they even go into that program at all.
And I think just by having that information from the evaluations that we do, they are play-based, but we're using an assessment tool. So we're giving a really nice picture for the family of their child's development, of the skills that they have, and then kind of what's expected for them next.
Maureen, it sounds like Child and Family Connections is probably one of the first agencies that maybe people in the community, the citizens of the community of Addison, young families, parents, would be touching when they contact Apple. That would probably be one of the first stops that a family with young children would be making so they can get those assessments.
Absolutely, could potentially be, because obviously they can start providing evaluations and therapy from birth, from a very young age. So it is one of the most essential agencies that we can connect families with, and one of those that they can be connected with immediately. So if the need is there.
And when they make that contact and outreach to Apple, with lots of questions, do you kind of have to say, okay, there's a process and a evaluation, the early intervention that you go through first, because you may not be equipped to be able to answer all of those questions early on? Is that right?
Absolutely, and we've been discussing this recently too. Early intervention has a lot of children that are referred to the program, and it is important that we try to determine those kids that really are in need. So being able to do a developmental screening is a really important first step before they get referred to early intervention. Developmental screenings are a very, very basic, very simple screening that can be done just with a parent questionnaire oftentimes, which is typically what we do and what most communities do. And once that developmental screening is completed, you can get a better picture of whether they may or may not qualify for a further evaluation through early intervention. So,
would you agree with that, Julie? I mean, it sounds like you have
Yes.
to catch them right at the very beginning. Then, right?
Absolutely, and just having that information from the screening is always helpful as well. You know, like Maureen said, the developmental screening touches on a lot, and then we're able to do a more in-depth assessment. So in addition to developmental therapy, we have speech therapy, occupational therapy, physical therapy, even some nutrition services. We can do hearing and vision screenings for families, and so really kind of covering a much broader spectrum and then more in-depth information.
Jillian, is it more difficult if there was a medical issue at birth? You mentioned some really young ones come right from NICU situation into early intervention. Does that just add more challenges, or is that just something you have to make sure you work into the overall assessment?
Yeah, and
plan?
sometimes it's just going to be a bigger plan for that child. They're going to have more therapists that they're working with, and then we might be working more with their medical services as well.
Okay.
Just kind of partnering to make sure that we are all on the same page, you know, that the family's not getting like mixed messages from services that they might be getting medically versus from early intervention, just so that they do feel supported more than anything.
Would early intervention be able to work directly with a medical provider then, or do you have to route things through the
Yeah, we would keep it a little bit
families?
separate. So all of our early intervention providers are credentialed through the state to work specifically in the early intervention system. Some of them do also work in a medical program as well, but typically they're solely enrolled in the early intervention system.
Very good. It's amazing that we have now come to this point in early childhood development. The safety, we thought we had it, right? I mean, 20, 30 years ago, we thought everything was dialed in, and now we're coming to find out there are new approaches and new models that can be followed. I was just thinking, what a safety net that this must be for young parents, young families, you know, with young children, and how important it has been locally to make sure that we have, for example, the Addison Early Learning Center. District 4 made a huge investment to put that facility in at Ardmore School, correct? I know other communities do the same thing.
Yes.
And then you have a center at Fullerton also. So, you know, that's all locally generated. That's a big step that Addison District 4, I would say, speaking on their behalf, they're not here to respond, but they probably agree with me. That was a huge commitment the community had to make for these services.
absolutely, we're so fortunate to have both programs. Actually, 3 programs. We have the Addison Children's Center, that's a standalone program or standalone building. We have the Addison Early Learning Center, and there's also a 3 to 5 program at Army Trail that's located at Army Trail. So having all 3 of those options for families as far as preschool is essential. We can always use more spots. There's always room for more. There's oftentimes waiting lists at these locations, but we're so fortunate to have the places that we have.
Addison, I would say, has been unique in that, I mean, what do we have, up to 9? I think we're up to 9 elementary buildings now that serve this community. That's a lot.
Right.
But there's a need for all of that too. And where some communities, a lot of those school buildings maybe, you know, were shuttered or they repurposed, whatever. Addison has really kept those buildings going, and they've just grown
Right.
over the decades.
You know, and having the opportunity to work all throughout DuPage County, we're working with all the communities, obviously, and, you know, what Addison has with Apple is not consistent throughout DuPage. So, you know, we're working with families and we're really in there to support the family and build caregiver capacity. And sometimes there's additional needs that we have to help link the family to. And not every community has an early childhood collaborative. So when we're working with the family in Addison who maybe needs housing or food or some other supports, to just be able to go back to Apple and say, who are our partners, who's at the table, who can we refer this family to? it just provides that much more support for the families.
We've talked with healthcare, your collaborators in healthcare, library, housing. Boy, we have the Girl Scout organization. I mean, anybody who could bring anything to the table, I think, is something that you want. YWCA, that was the other one I was trying to remember. I knew there was another one. YWCA for sure, because they offer really great social services throughout the Chicagoland area. So, Maureen, let's talk about some upcoming events and kind of bringing it all home now is how do you deliver these services to the community? And there are a number of community-based events, a lot of fun events that are offered in the community. So let's first talk about, I guess, kind of keeping in line with our discussion here, developmental screening days at the Early Learning Center.
Yes.
Want to just touch on that and tell us what that's all about?
3 upcoming developmental screening days. The developmental screenings do occur throughout the majority of the year. In the past, they really did them throughout the entire calendar year, but they've realized that they need to stick with March through November. So typically, they're doing developmental screenings March through November. There are 3 more coming up in the next couple of months, one on April 11th, one on May 14th, and then one on May 31st. That date was just changed. It changed from the 28th to the 31st.
Got it. Alrighty.
The 11th is already booked. So if families and parents are interested in doing a developmental screening for their child to see if they might qualify or be eligible for preschool, they should definitely try to register for one of those screening events.
Do they register through the School District 4
They do.
offices?
ASD4 on their website. If you click on the Addison Early Learning Center, you can find the registration information for those developmental screening days.
Great. Now we have the summer kickoff and kindergarten carnival. We talked about this with the ASD4 people. You just want to give a mention of that because I know it's a big fun event. I'm sure you will be there represented with all of your organizations.
Yeah, we're very excited for this event. It used to be 2 separate events, the summer kickoff and the kindergarten carnival. They're combining the 2 into one, so it'll be one very big fun event. Touch a Truck will be there, and there'll be games, there'll be raffle items. The PTA, as I understand it, is going to be there selling food to benefit the PTA for the district.
Always a good thing.
Yeah, and then we'll have a lot of great resources for families too. The Hamdard Mobile Health Program will be there, providing school physicals for children. They will also be providing vaccinations for kids that need those for starting school. Kids can register for school. That will be the last day that families can register and receive a $25 discount. After that day, they cannot get that discount any longer. So we're hoping to get a lot of families registered for that day. And we'll also be providing backpacks for kindergartners who will be attending the kindergarten camp.
Very good.
So, yep.
May 16th, Thursday, May 16th.
Exactly.
4 until 8. Right?
You got it.
At Indian Trail Junior High. And then the kindergarten camp registration, right, is going on right now. And when is kindergarten camp held?
So kindergarten camp isn't until towards the end of the summer. It's the week of July 29th to August 2nd. But registration is happening now, so it's important for families to register if they're interested in attending those camps. The camps will be held at each of the individual, not every individual elementary school, but several of the elementary schools, and so families can kind of go to their home elementary school to determine how to register for that. Or the other option is there's a box that you can check on the regular school registration for next year. They can check a box saying that they'd like to register for that camp as well.
Now, to outreach to Apple, to get a hold of the Apple organization for any questions, services, I need to make a contact about something, what is the best way to go about doing that?
So our website is on the Addison School District 4 website as well. It's under resources for parents. So you can click on that and find resources and find the contact information for Apple.
ASD4.org. Now, Jillian, is that the best way then for people to connect with your organization, or should they do that separately?
So Maureen had talked about IRIS, which is a referral system that we have, and so if they were to reach out to Apple and they had concerns for their child, they could refer to early intervention through IRIS. We also have a parent agency. We're under Day One Pact, so our website is dayonepact.org, and there's resources and information about the Child and Family Connections office, but families can call directly as well. We have an intake line.
Very good. What's our takeaway from all of the information that we provided today to our community, families, parents, especially if there are really young kids in the family and, they have questions. So when you hear all of this, what's really the key takeaway? What would you say, Jillian, is something you really want to make sure that parents who may be having their kids in an early intervention program are aware of? What would you say to them?
For me, I would say that the resources are there, that the resources exist. So many times families find us and they say, I never even knew that this was a possibility. I wish my son or my daughter has been in this for years. They find us when they're 2.5, they call school and school sends them our way. So just if you have a concern, talk to your pediatrician, find a way to get to the early intervention program, I think is really important for families to know.
Very good. Maureen?
Absolutely.
You're going to be back on many other occasions, I know, but for today anyway, what would be your take?
I would agree wholeheartedly with Jillian. It's really just important for parents to not hold back. Don't question your thoughts. If you're really thinking, I'm concerned about my child's development, even if it's a mild concern, it can't hurt to reach out. And while you can go through your pediatrician, as I understand it, as a parent, you can go directly to early intervention and request an evaluation as well. You don't have to go through a pediatrician or through somebody else. Parents can do that directly if they have a concern, and don't wait. So
right.
the big message is don't wait.
That's right. Those resources are available, and take advantage of them. We have been speaking today about the early intervention programs available throughout the community of Addison, and of course the great services provided by Apple. Joining us today have been Maureen Reedy, Project Director for Apple, and Jillian Santora, Local Interagency Coordinator for Child and Family Connections of DuPage. Thank you very much for being with us.
Thank you.